Welcome to MicroSurgical Endodontics, and thank you for trusting us with your endodontic care. I would like to spend a couple of minutes explaining the procedure you're about to undergo. Root canal therapy is an attempt to save a tooth that would otherwise be extracted. Your alternative to root canal therapy is usually an extraction, which is basically pulling the tooth. Unless the prognosis for saving your own tooth is poor, it's usually best to try to save your tooth as long as possible. The first step in trying to save your own tooth is a non-surgical root canal procedure. Contrary to popular belief, however, this procedure is quite painless. The root canal space is a hair-thin space in the middle of your root. Inflammation or infection in this small area due to deep fillings or cracks can cause discomfort. During a non-surgical root canal, a small access opening is made on top of the tooth, and the root canals are cleaned and filled with a plastic filling material called gutta percha. The access opening is then filled with a provisional filling. Basically, a non-surgical root canal is a deep filling inside the root. Within a month following root canal therapy, you should return to your general dentist for 2 additional restorative steps, a core buildup and a crown. Every case is different, and you may require additional steps to restore your tooth. However, unless instructed otherwise, you must follow up with your restorative dentist following the root canal for final restoration of the access opening in the treated tooth. Failure to do so on a timely basis can result in reinfection of the root canal or possible tooth loss. The root canal procedure generally has a very good long-term prognosis. The exact prognosis of any given case is dependent on the specific factors related to that case. Your prognosis will be explained to you based on the clinical findings. Around 90% of teeth can be saved with a single non-surgical root canal procedure. But occasionally, the infection does not respond to non-surgical treatment, and the disease process can persist. If symptoms do not subside within a month following the non-surgical root canal therapy, a surgical root canal therapy approach may be needed to address the residual disease. If you have remaining symptoms after a month, please contact our office for a reevaluation. During your procedure, please communicate with us your specific needs and any way that we can make you feel more comfortable. Our goal is to make you feel as comfortable as possible. Thank you for choosing MicroSurgical Endo.